My name is Dr. Kaur. I am MD Scholar, Department of Panchakarma. So we will discuss two therapies today. One will be Nasya and other will be Karan Purana. Okay. So firstly, introduction to Nasya therapy.
Please set this off because
Write down your questions, and I will try to answer those questions at the end of my presentation. Okay. So firstly, introduction to Nasya therapy. Nasya is one among the 5 ayurvedic therapies which are collectively known as Panchakarma. As we have already discussed, there are 5 therapies in the Panchakarma. As the word says, Panchakarma, 5 therapies. So Vaman, that is induced emesis, Virechan, induced purgation, Basti, enema, and one is Nasya. So Nasya is out of these 5 therapies. Unlike the other detox therapies which are focusing on the pacification of particular doshas, this therapy is quite unique as it aims at pacification of any disorder in the head and the neck region. So this therapy is basically for above the shoulder region, so neck, mouth as well as brain. So what is Nasya? Nasya is an Ayurvedic detox therapy in which medicated oil are instilled through the nose in the prescribed dose. So the dose can vary from 2 drops to 10 drops each nostril. As per Ayurveda, nasal route is the best way to reach the brain. Hence, any disease occurring in the region above shoulder can be tackled more appropriately by Nasya therapy. So, when to go for Nasya? Firstly, sinusitis. As we know that when the inflammation of sinuses occur, there will be heaviness in the facial area along with headache and stuffiness or sometimes runny nose. So, in these conditions, sinusitis conditions, we can use Nasya. Next is cervical spondylosis, pain in the cervical region, that is neck region along with shoulders. In that condition we can use Nasya. Headache, any kind of headache, and in this condition we can use facial paralysis. There is paralysis of the one side of face, that is known as facial paralysis. In this condition Nasya can be used. Frozen shoulder, as the name says, when your shoulder stucks and your range of movement of the shoulder joint decreases a lot along with pain in the shoulder joint, that is known as frozen shoulder. So in this condition Nasya can be used. Premature graying of hairs, very common nowadays. Hair fall. Psychological disorders varying from anxiety, depression to manic disorders. Allergic rhinitis. The symptoms of allergic rhinitis are lacrimation, that is watery eye, runny nose, cough and excessive sneezing. So requirement for the Nasya therapy: table with a facility to lower the head position. So the same Abhyanga table we have used earlier, we will use same Abhyanga table, but we will make arrangement to tilt the to elevate the neck so that our head will be tilted. Along with til tel for mukhabhyang, sesame oil for mukhabhyang, that is facial massage. So sesame oil for facial massage, anu tel for Nasya. So here I am taking an example of a medicated oil. The name of oil is anu tel, and this is very safe oil, can be used for any kind of condition as well as in healthy person for Nasya therapy. So this anu tel is used for Nasya here. Spitting pot, lukewarm water for kaval. Kaval is a therapy where what we will do. We will do the mouth cooling with medicated water or sometimes with only lukewarm water. So that is known as kaval. Dhumpan vati. Dhumpan is fume inhalations. Medicated fumes are inhaled in this therapy. So dhumpan vati prepared of hardra and grit as well as dhumpan netra. So it is the equipment to hold the dhum netra. Dhum netra is a wick made up of medicated powders. Dropper, heating apparatus, bowl, pressure cooker attached with pipe for nadi swedan. Nadi swedan is steaming, so pressure cooker attached with pipe to do the steaming process. Cotton pad and gauze piece. So pre-procedure, what we have to do before doing the main Nasya therapy. Patient is advised to come in early morning after avoiding the natural urges. The patient is advised to lie down on the Nasya table with head low position, as we can see in this picture. So there is a little tilt in the head just to increase the absorption of Nasya oil. Therapist should stand at the head end of of the table to carry out Mukh Abhyang, that is facial massage, and Bashpadan, that is steaming. Face and neck of the patient is anointed with lukewarm oil, and forehead, eyebrows, nose, chin and maxillary area is massaged with linear thumb movements, as we have already described you the facial massage therapies. So that will be done. Cheek and temporal region is massaged with circular movements of the palm in both clockwise as well as anti-clockwise direction. Interior of the neck is massaged by moving the flat of the palms from the base of the neck to the mandible. So these are the techniques for facial massage. And lastly, Nadi Swedan, that is steaming, is done to the face as well as neck with covering the eyes with cotton pad. So we will cover the eyes with cotton pad because in Ayurveda it is described that do not do any heating procedure over the eyes. It is not beneficial, rather than it will harm your eyes. So to protect the eyes, we will cover them with cotton pads. Lastly, procedure. The patient is advised to lie down in the supine position with head lowered backward for about 45 degrees. The Anutel, the medicated oil, is made lukewarm by indirect heating source. So whenever we use some oil for any kind of therapies for Panchakarma, we do not heat directly it over the heater. So instead of that, we will take some hot water in a pan, we will take some oil in the bowl, and we will place that bowl in that water to make it lukewarm. We will never ever directly heat that medicated oil. Anutel is taken in a dropper. Now the therapist should stand at the head end of the table and elevate the tip of the patient nose with the left thumb. In the right hand, he will hold the dropper. With the left hand, he will elevate the tip of nose like this. We have to elevate the tip of nose with the left thumb, and the Anutel is instilled in each nostril with the dropper. After instilling the oil in one nostril, the other nostril is closed with a finger, and the patient is advised to take deep inhalation. So the same procedure will be repeated in the other nostril. So this is how it will be done. Post procedure, the patient is asked to spat out medicines that reaches the throat. Whenever we will instill some oil in nose, it will automatically reach your throat. So we do not have to swallow that, we have to spat it out. Gentle massage is done on the forehead, palm and sole of the patient. After instilling the oil, we will ask the patient to rub his hand, or we can do the massage of palm and sole as well. The patient is allowed to take rest in the supine position for 15 minutes. Then the patient is allowed to wash the mouth and face with hot water. Instead of that, we can also do we can take that warm towel and we can wipe off the excess oil on the face of the patient. Then cover, that is mouth cooling with medicated oil or simply with lukewarm water, we can do that. Cover should be done with warm water. And lastly, dhumpan, that is fume inhalations, it is carried out. So these things you will come to know when we will do the practical session. These things will be very clear to you that how these will be done.
Dhumapana is carried out. What do you mean by that? Carried out.
At last we will do the dhumpan.
Okay.
So one to avoid Nasya, there are some certain conditions in which Nasya is not advisable. Firstly, as we have discussed yesterday, indigestion. In the state of indigestion, we do not advise any kind of Panchakarma therapy. Immediately after taking food, because immediately after taking food, if we will do Nasya, it can cause nausea and vomiting to the patient. So after bathe, there will be temperature variation, we will do steaming, so that can induce headache to the patient. After drinking water, same again, it can cause nausea as well as headache to the patient. Acute fever, as we have discussed yesterday, we do not do any kind of Panchakarma therapy in condition of acute fever. Immediately after physical exertion, pregnant women, children under the age of 7 years, because they will be anxious that something is there is in their nose and they are not able to breathe properly. So they can be anxious. To avoid that, we will not do Nasya under the age of 7 years. And during any major Panchakarma therapy, that is Shodhan therapy, that is Vaman Virechan, immediately after Vaman Virechan, without consulting doctor, you cannot do Nasya therapy. So we have to take care of this. And preventive and safety measures. Vyapada, that is complications after administration of Nasya, occurs in the following condition. If the patient breached the protocol to be followed after Nasya Karma, as patient is not advised to take any cold water or wash his face with the cold water. So these things we have to take care that sheath upchar, patient should not go in directly into the cold wind after the therapy. So the patient should not breach these protocols. On administration of Nasya in any contraindicated condition, and due to technical failure by means that if the equipment are not working properly, if the masseur is not trained properly, then some complications can occur. To avoid these, we have to take care. Now next therapy is Karan Purana. As we can see in the picture, it is the filling of ears with oil. So what is Karan Purana? Karan Purana is made up of two words, that is Karan and Puran. Karan is ears and Puran is filled. So it is a process in which ear is filled with medicated oil. So when to do Karan Purana? In case of earache, in case of mandible stiffness, mandible is this bone is known as mandible. So whenever there is stiffness, the patient is not able to open his mouth. There is stiffness in some condition, there is stiffness of this joint. So in that condition, Karan Purana can be done. Headache, deafness due to aging, senile deafness, in that condition. Tinnitus, ringing sound in the ears, that condition. Pain in the mandible and neck stiffness. When to avoid Karan Purana? Perforated tympanic membrane. When the eardrum is perforated, in that condition Karan Purana is not advisable. Likewise, there are two other conditions, CSOM. It is the acute infection of the ear when there is a pus discharge from the ear. So in this condition we will avoid Karan Purana. Preoperative procedure. Person should be made to lie down on the lateral side, and hand of that side should be beneath head, and other hand should be resting on the trunk of that side. Gentle massage should be done with lukewarm medicated oil around the ear and pinna for a short duration of time, approximately 5 to 7 minutes. Basically, doing any shaman therapies which we are discussing here, we always do some sort of Svedana and that is Snehan and Svedan, that is Thanik Abhyang, that is massage, as followed by Svedan, that is steaming. So we are always in Panchakarma we do these two therapies before doing any major therapy. Okay. So for massage should also cover the lateral portion of the neck inferior to the ears. So we will massage the lateral portion of the neck as well. After this, heat is applied around the ear with towel soaked in a boiling water by waving, by touching and by pressing for some time, approximately 10 minutes. It is the maximum time. We can do it for 5 minutes as well. So the main procedure, the medicated liquid, that is oil, that should be heated in a hot water bath to make it lukewarm, as I have already told you. So the external auditory canal should be straightened by pulling the pinna. This portion of the ear is known as pinna. We will pull it backward and upward, okay, to straighten the ear canal, because our ear canal is not straight. So we will pull it backward and upward to straighten the ear canal. Now the liquid oil should be poured in drops till the ear canal is filled. The root of the ear should be gently massaged in order to potentiate the action of drug. Now lastly, the medicated oil should be retained in the same position for prescribed limit, that can vary from 5 minutes to 10 minutes. Post procedure, the excess oil should be taken out of the external auditory canal by dry cotton, and after retaining the medicated oil, that is oil for the prescribed time, the ear should be cleaned with dry cotton mopping. So we will remove the excess oil and then we will close the ear canal with the help of cotton. The same procedure should be repeated in the fallow ear as well. So this is the whole Karan Purana procedure. Thank you. If you have any questions?
You mentioned about the kawal. So how do you prepare the medicated water?
We can take trifla. We can make decoction of trifla. It is one of the simplest medicine we can prepare.
So in a warm water or you need to boil?
There is a proper procedure of making a decoction. We will take certain amount of trifla. We will heat in a water, and then when it will reduce to some extent, we will use it as a decoction.
For Karan Purana, which oil do we use?
We can use sesame oil, simple sesame oil. We can use Ksheer Bala oil. We can use Dhanvantram oil. We can use Vishyagarva oil, depending on the condition of the patient. which we
So
are
is there
tackling.
anyone like
In
which
general,
goes
we-
like in general?
Yeah.
In general, sesame oil is best.
Sesame goes that I think everything like
Yeah,
Nasya-
sesame can go for any abhyanga as well as any massage and for any Panchakarma therapies. It
And
can
in
go.
Nasya, we can use as well. Sesame oil.
Anutal, yes, Anutal is very good for Nasya. Even though in healthy
not,
person
not
it is
sesame oil.
sesame oil can also be used, but Anutal is more beneficial.
और काढ़ा कोकोनट भी होता है कोकोनट ऑयल
Coconut oil can also be used. Yes.
Can you explain the
Nasya
process
can
once
be used
again?
for like-
First, we need to do the face massage. Then we need to
This
do the
thing you will come to know when we
Yes.
do the procedure. When once you will do it with your hand, you are not going to forget about the sequence.
Yeah.
Ma'am, Nasya or any other type of oil can be used?
Yeah, for Nasya, it again depends upon the condition. If you are tackling the hair fall or graying of hair, we will use Bringraj oil. Okay, and when we use that is in case of allergic rhinitis, we will use Shad Bindu Tel. So there are different oils. So depending upon the condition, these oils can vary. But for a healthy person, we can use Anu Tel. Yeah.
that pinna thing, where is that pinna?
This here, this
Earlobe.
portion of the ear.
So earlobe is known as.
Yeah.
Earlobe, yes.
Ma'am, you said like we can use Nasya for deafness also.
Yeah, it will. Yeah, if it is due to senile deafness, that is due to age, which is generally found in 60 to 70 years of age, it will definitely improve their condition.
And if the deafness is to the young children like 10 to 12 years old boys.
If there is no certain cause which cannot be removed, then it can be tackled. Then it can be managed. But if there is damage to the inner ear, there are many structures in the inner ear. If there are damage to that part or the part is missing, then it cannot be managed.
How do we come to know about all these oils?
Yeah.
For that you have to study Dravya Gun Vigyan as they are discussing with you. You should know the properties of plants firstly. Then only you come to know that which oil can be used, because these oils contain 20 to 30 herbs, each of the oils. So then only you can come to know that what will be the guna, what will be the property of that medicated oil.
So to be under that practice that we can do it, legal practice.
You have to read it first. You have to
So we are
learn.
free. We are
You
free
have to
to
learn Dravya Gun Vigyan.
Okay.
Yeah.
Okay. One
So
more question.
Anutel is also combination of multiple oils.
Sorry.
Anutel is also combination of multiple oils, or it is single?
It is a single oil, which is in its composition there are minimum of 30 to 40 herbs used.
In Anutel.
Anutel, yes.
So what is the best oil for that?
Anutel is the best for Nasya.
For Nasya and ear, we are using the warm oil, right?
For every procedure we use
We
warm
use the
oil.
warm
For
oil.
Abhyanga also we have used
Yeah.
warm oil.
The name of the book for you
Okay.
said.
Yes.
The book for the medicated herb you said.
Sorry.
Not
For that,
You just said
the
the-
Dravya Gun Vigyan students, they will give you the correct answer to that question.
Okay.
I'm sorry.
Yes,
I
ma'am.
need to
Yes,
do that.
yes, yes.
We have different sinuses. When you
Yes.
do the Nasya, how do you take care that the oil goes in every, or do you only take special sinuses?
No, we never ever take a special sinus that we have to instill oil in the sinus. We will just fill the mucosa of the nose, and it will the drug absorption will take place from the mucosa of the nose itself, and it will reduce the inflammation of sinus.
So you do not change the position of the head to
No,
fill
no.
all these different sinuses?
No, we do not. Nasya is done in same position, that is 45 degrees tilt to the head.
Will be will
Just a minute, Hanji.
Ma'am, if an old person around 85 years of
Yes.
age is using hearing aid, will Kanpurna help?
Yes, Karan Purana will definitely help.
How long it will take the process means for
It
how-
can vary. It depends upon the condition, that since how long he is suffering from. If it is acute, that he has suffered from deafness since last 1 and 2 years, Karan Purana for 2-3 months can be definitely helpful to that patient. Daily, yes, daily.
once a time,
Once a day.
and that will be in the morning.
No, it can be done in the evening as well. Nasya should be done in the morning. Karan Purana can be done at any time during the day.
The reason
will
for
it be
this morning Nasya, what is the logic behind?
Again, I have told you that if you have taken some meal during the daytime, it is generally done empty stomach. The reason is that it should be done empty stomach. If you have taken some meal and then it cannot be done. But if you have taken meals 3-4 hours back, then it can be done.
In the evening as well?
Generally we avoid in the evening.
Ma'am, will it be under our legal practice that we can pick out of the knowledge that we have which oil is the best way to do the Nasya?
For that we have already told you some of the oils. You can use those oils.
Okay.
Sheerwala tel, anu tel, sesame oil. These are some of
So
the
whatever
oils you
we
can
think,
use.
as per the knowledge that we have, okay, what's the best one, we can go for that thing.
Yes, you can go for these oils. They are safe.
Safe.
Yes, and they will also give you benefits.
And when you add those oils in this PPT, what
Okay, definitely. Yes.
Ma'am, we'll have to put 10 drops for that ear leakage problem.
That'll-
Until the ear canal is filled, you will see the oil. Yes.
And then leave it for 15-20.
10 drops are for Nasya. For Karan Purana, you have to fill the whole ear canal with oil.
And we'll have to leave it for 15 to 20 minutes.
No, for 5 minutes. Good enough. 5 minutes. Thank you.
Thank you.
Right.